So I'm going to be speaking a little bit about UN Group of Friends to Eliminate Hepatitis, which is actually an initiative of its kind. So the efforts for this initiative began around middle of this year when Dr. John Ward started to reach out to friends, colleagues, global network, and connections that were built through years of working for hepatitis elimination and leading the community of practice. What emerged through this was a hugely successful side event that was held as a UNGS side event in New York on September 20th. And at this event, we brought together representatives from health ministries, foreign affairs, national hepatitis program managers, academics, and they shared the platform with UN permanent representatives, which was a very unique opportunity to build political will and political commitment to put hepatitis on the forefront for discussion, which happens very rarely, as all of us know, being a part of hepatitis program. So I would like to share some highlights of this side event.
We truly are at a miraculous moment.
I sense a real momentum now because we have these great drugs and very good tests.
I want to thank the Coalition for Global Hepatitis Elimination, the Task Force for the Global Health, and all the member states and partners here today for bringing us together. We estimate that there are currently over 300 million cases of chronic hepatitis B and hepatitis C worldwide, and an estimated 3 million people getting newly infected each year and 1.1 million deaths. And this is just simply put too much.
Hepatitis has been neglected for far too long.
We are very glad to share our experiences in this regard.
Egypt expressed the full support to the group of friends and the opportunity to lead the effort for the first year.
Portugal supports the creation of a UN group for Friends to Eliminate Hepatitis, which will be proud to join.
Therefore, Malaysia invites all member states to join us in forming the UN Group of Friends to Eliminate Hepatitis.
Chile joins happily and very determinedly this call to launch a UN Group of Friends for global elimination of viral hepatitis. We strongly support the world joining these public health strategies for the control and elimination of hepatitis by 2030.
We are willing, able, and are here to be part of this friendship circle.
The time has come for decisive collective action, which is why we appreciate this gathering.
We are overwhelmed because hepatitis in Sierra Leone has increased considerably. So on behalf of the government of Sierra Leone is willing and happy to join the group of friends for the elimination of hepatitis.
There is an African proverb that says, if you want to go fast, go alone. If you want to go far, go together.
So at this event, there were representatives from 20 different countries who were present there, and they agreed to launch this group of friends to eliminate hepatitis under Egypt's leadership for year one. So from Egypt's side, His Eminence, Ambassador Osama Abdul Khalik, is going to lead this initiative, and he's in a perfect position because he is permanent representative to Arab Republic of Egypt to the UN. And he has a few words to say to the audience present here.
Hepatitis as a global health problem and the need for advocacy with governments and stakeholders on disease prevention, diagnosis, and treatment, it is evident that we can only overcome this epidemic through increased solidarity and cooperation to ensure that we leave no one behind. Today, I'm pleased to share with you that Egypt has agreed to chair a group of friends at the UN here in New York on hepatitis elimination to advance efforts to eliminate this disease by 2030. Through this group, we hope we accelerate efforts to combat hepatitis and achieve SDG 3.3 by 2030. Ensuring the highest attainable standard of health for all must be a priority as we strive to achieve Agenda 2030 for sustainable development and recover from COVID-19 pandemic. We must also ensure that developing nations have access to vaccination, diagnostics, medicines, and other health technologies to prevent increase in cases. It is our hope that we contribute to the promotion of global efforts toward this goal. Once more, distinguished participants, I wish you all a fruitful meeting and look forward to following the outcomes of your important deliberations. I do thank you.
So all member states are invited to join the group of friends. As I mentioned earlier, that representatives from 20 different countries came together for this event, and we now have 16 countries who are officially part of UN Group of Friends for Hepatitis Elimination, and we have 18 different organizations supporting the initiative. These include WHO UN New York, WHO Geneva, UNICEF New York, World Hepatitis Alliance, the Hepatitis Fund, Gilead, CHAI, CDC Africa, and the list goes on. So the Secretariat for Group of Friends to Eliminate Hepatitis is housed at Coalition for Global Hepatitis Elimination, Task Force for Global Health. You can find more information about the Group of Friends at our website, globalhep.org/UN Group of Friends to Eliminate Hepatitis. And you can also sign up for our newsletter, where we'll be sharing regular updates about the group as well as upcoming future events. Thank you.